COVID-19 came out of, it seemed like left field for, I think, all of healthcare providers, and it has really affected us in a lot of different ways. What we've seen is, we have this pandemic with a very highly communicable disease. So our goal is to reduce our patients from having exposure to this. So from that, we've had to really change the way we generally work. Typically, our patients come into our office, we see them, we assess them, we examine them, and then we make plans for their health based on all this information. We've had to switch over in terms of being able to get as much information as we can in a virtual sense, so using either telephone or video visits for our patients. So that's been a lot of a change from both the physician perspective, but also our administrator, and for our patients, because we're trying to find the safest way to see them without letting them have to leave their home and potentially get infected. When we look back at various pandemics, there often have second waves when they lift up these kind of restrictions. So in my mind, I'm thinking, what can we do from the office perspective to minimize how many patients are in the waiting room at any one time? We don't want to return to crowded waiting rooms if we can. That's also changing the way I think about how to practice and how to create my clinic flow to allow patients to be seen in an efficient manner without them having increased risk of any exposures. Likely we'll still be doing things like screening when we go back to work, in terms of patients needing to have some kind of screening prior to them being allowed to come into the office. And I think that's going to have a bit of anxiety on a lot of different people's perspectives, right? So like, our patients are going to be worried. We're worried about having too many patients in the office. Our administration, our nursing, our various staff are worried about transmission as well. So there's going to be a lot of changes in terms of the way we're thinking with the return to practice. I think the future of medicine, healthcare, and just, I think the future of just how we interact on the street and the grocery store will be different after this pandemic. This is going to leave a mark on us. We're going to have to change. And I think that we're going to be trying new models out, and we're going to be looking at ways of trying to build in care in a way that we don't contribute to any kind of mass gatherings.